Hello and welcome back to Pharma Mastery Hub. If today is your first time, this is a place where pharmacy meets mastery. Today we'll be looking at ophthalmic solutions. We'll be looking at ANTALLERGE eye drop. So what is the composition of ANTALLERGE? It contains anthazoline hydrochloride, which is a potent short-acting antihistamine, and it also contains tetrahydrozoline hydrochloride, which is a sympathomimetic amine with potent vasoconstrictor properties. Now, when we say potent vasoconstrictor properties, we are trying to say that it has the ability to narrow blood vessels, constrict, vasoconstrictor. So mechanism of action, this is a combination product, right? So it exerts a dual action to relieve ocular symptoms. So antazolidine, which we said earlier, is an antihistamine, right? A short-acting antihistamine. It acts as a competitive antagonist of histamine at the H1 receptor site on the conjunctival blood vessels and sensory nerve ending. What it does is that it blocks histamine, thereby reducing the classic allergic response, including itching and edema. Then the second active ingredient, tetrahydrozoline, which is a vasoconstrictor, it directly stimulates alpha-adrenergic receptors in the arterioles of the conjunctiva. This causes vasoconstriction, reducing vascular permeability and thereby decreasing redness, lid swelling, and excessive tearing. Indications. ANTALLERGE is indicated for the symptomatic relief of allergic conjunctivitis and associated signs, specifically ocular itching, conjunctival redness, lid swelling, excessive tearing associated with allergy, such as hay fever, dust, pollen, and pet danders. Dosage and administration. Remember, this is for the educational use only. As a pharmacist, when you see this, you already know what to do, right? These contents are basically for the healthcare professional. As a patient, ensure you consult your doctor before use. So in acute phase, 1 drop every 3 hours, and for continuous use, 1 drop 2 to 3 times daily is sufficient. In severe cases, ANTALLERGE eye drop can be used as frequently as every 1 hour. So let me stop there. Contraindications. ANTALLERGE is contraindicated in the following patients. Yes, this population of persons: people who are hypersensitive or allergic to any of the active ingredients and the products should not use it. People that have narrow angle glaucoma should not use it. For people that have narrow angle glaucoma, vasoconstriction can cause pupillary dilation, which is mydriasis, which may precipitate an acute attack of angular closure glaucoma. If you are in any of this category, it is important you don't use it. Now, for those with severe cardiovascular diseases, that's patients with hypertension, coronary artery disease, or arrhythmia due to sympathomimetic action of tetrahydrozoline, they are not to use it. People that have aneurysm or pheochromocytoma should not use it. Children under 2 years of age, strictly due to risk of central nervous system depression from systemic absorption, they should not use it. And patients using monoamine oxidase inhibitors or any tetracyclic antidepressants, they shouldn't use it because its use can potentiate the depressor effect of sympathomimetic drugs. Now, precautions and warnings. There's systemic absorption, right? So although it is rare, excessive use or use in sensitive individuals, especially children and elderly, may lead to systemic effects such as tachycardia, hypertension, palpitation, dizziness, and headache. There's also rebound hyperemia, that's prolonged use beyond 5 to 7 days of vasoconstrictors can lead to rebound congestion and redness upon discontinuation. That's rhinitis medicamentosa, which is equivalent in the eye. People who are using contact lenses, it is advised that they should remove the contact lenses before installation, because the preservative, most of the time they are preservative in these products, they can be absorbed by the soft contact lenses and they will cause ocular irritation or discoloration of the lenses. Pregnant and lactating mothers. When pregnant and lactating mothers are supposed to take some drugs, the benefit have to outweigh the risk. But in most cases, If the drug is contraindicated, do not use. Now, for those that are driving, it may cause transient blurring of vision or pupillary dilation, so patients should wait until the vision clears before driving. All these are important. So, advice to patients: as a pharmacist, you should counsel the patient on the following: the persistence of symptoms. If your eye are not better after 48 hours, or if the irritation or redness increases, stop using this and return to the pharmacy or see your doctor. Like I said about contact lenses earlier, pharmacists will tell them remove your contact lenses before using this drug. You can put them back. You tell them they can put it back after 10 to 15 minutes. Proper hygiene. Ensure you tell them do not let the bottle tip touch your eye. Also tell them to wash their hand. Then on that thing again, the sting sensation. You advise the patient about the mild transient stinging or burning sensation that is common, during installation, and this is due to the pH of antazolene. I've encountered a patient who has experienced this, so telling them is important. If not, they'll just stop the drug. Then the frequency, you tell them do not use this medication more than 4 times a day unless your doctor tells you to. Now, overuse of that drug now can make your eyes become redder, so you tell them all these things so that they can adhere properly. Now, this advice now is to pharmacy. Over-the-counter recommendation strategy. Now, Antallerge is an ideal first-line recommendation for acute allergic conjunctivitis where both redness and itching are present. Now, the combination offers a faster relief of redness than antihistamine-only drops like pure antazolene. Now, differential diagnosis. Before recommending, distinguish between allergy and infection. It is important. Now, for the infection, you see that there's a gritty sensation, there's a purulent, that sticky discharge or crusting on the lid. Do not recommend this product for suspected bacterial conjunctivitis. Now, the red flag. If the patient persists with a red eye, photophobia, that's light sensitivity, visual disturbance, or a foreign body sensation, corneal abrasion, do not recommend over-the-counter use. Also, as a pharmacist, you have to check for drug interaction. Always verify if the patient is taking any monoamine oxidase inhibitor or blood pressure medication, because tetrahydrozoline can interfere with antihypertensive control. If you find this information helpful, don't forget to like, share, and subscribe.